talking about the teeth. We've been talking about oral hygiene, we've been talking about dental cosmetic, and for today this is going to be our last episode, and we are at the News Medical Center, and we'll be joined by a very good doctor, Dr. Akansha Shumar, who is just going to give us a little bit about oral hygiene. Thank you very much.
Hi. Nice to
meet you. Yeah.
Nice to meet you. Everything is fine. How about you?
I'm very okay.
Yeah.
So when we talk about cosmetic dentistry,
right,
why is it very important right now? Everyone is doing it. Everyone is running.
Yes. See, everybody is very cautious about how they look and aesthetics these days, and the main reason is it gives them confidence.
It gives them confidence.
Yes.
And I guess that is also another reason for being called smile correction. Am I correct?
Yes, you're very right. Yeah, that is what is called smile correction. So we give you a good smile.
So if I have a gap in my teeth,
yes,
I'm having a gap, can it be corrected?
Definitely. Yeah. Yes, definitely. There's a solution to everything these days. Okay. Yeah.
So you're telling us that everything is
possible.
Everything is possible.
Yes.
Yeah, I think you lead the way as we go and settle down and leave our people with something to know about the teeth. See you at the other end.
Importance of having teeth. Eating. The teeth will grind the food that we eat to make them smaller and easier to swallow. It helps the food to be easily digested before it reaches down to the stomach. Makes you look better. Our teeth help us look good. Based on our research, teeth are among our crowning glory. It's one of the main features that can make us attractive. Self-confidence. Having a set of healthy teeth can also help you boost your self-confidence. People who often smile are often tagged as sociable and easy to get along with. Speech. Your teeth can help you make a variety of sounds. It helps you hold your tongue and form different tongue positions to pronounce different words. Retain bone. Your teeth can also keep your face in shape. They are connected to your jaw. Once you lose some teeth, your cheeks will sink and this will make you look old. Makes your jaw strong. Your teeth are connected to your gums, and the gums are connected to your jawbone. Tooth loss can also cause misalignment of the jaw. This can be a really painful experience. Having a healthy set of teeth is not only for substance, but it is also for better social allure and interaction. It is very important that we keep them healthy to avoid serious problems in the future.
Welcome back to Focus on Health. Thank you very much, Dr. Terry, for being with us today.
Hi, it's nice to be here.
Yeah, nice to be here. So we're going to go straight into what really we will be discussing today, cosmetic dentistry.
Yes.
When somebody says cosmetic dentistry, what really is cosmetic dentistry?
Cosmetic dentistry is any form of dental work which help improve the shape of the teeth, size, change in the bite, and aesthetics.
So cosmetic dentistry and smile correction, that is also another name. Smile correction is another name for cosmetic dentistry.
Yes.
Why that name?
Yes, because cosmetic dentistry, as I just mentioned, it changes the aesthetic of the teeth. Yeah, so aesthetic means smile correction. We change the smiles. That's why it's called smile correction as well. Yeah, and yeah.
Is it in any way related to that? Maybe somebody will be having will be more confident about themselves.
Definitely, these days everybody is very cautious about their appearances, and it starts from the face. And teeth are a very important part of our face, so I think it's really important. Yes, it does matter to people. Yes.
So we have a couple of cosmetic dentistry or cosmetic aesthetics, as you call them.
Yes.
What are some of them, and which one is more common right now?
There are a lot of things which fall under cosmetic dentistry. For example, there are veneers, there's crowns, there's bridges, there's bleaching we do. So they're all part of cosmetic dentistry. Yes.
Speaking from bleaching, what really is bleaching, and who does bleaching?
Bleaching is basically whitening of teeth, and there could be a lot of number of causes for discoloration of teeth. For example, teeth tea, coffee, and maybe high fluoride in water, which causes fluorosis. All these are the reasons which leads to discoloration of the teeth. And bleaching is a procedure we do to handle that.
Just having an overview of what, how would you conduct bleaching?
I'm sorry?
How would you conduct bleaching?
There are different kinds of bleaching we do. There is in-office bleaching, and there's another bleaching in which a patient can do it at home.
Yeah, it's called a homemade bleaching.
Yes.
Yeah. But how common or which one is more effective?
Both are as effective. Yes, both of them are as effective. Yeah, but most of the patients prefer doing it at home because it's more convenient and easier for them to do it at home, as it saves their visit to the dental office. Yeah.
Does it really work home-based? Home-based bleaching, does it really work?
Yes, it does. As in, what we do, we just make the trays. Patient has to come to us once. We make the trays according to their teeth shape and size. We give them the bleaching material. We explain them how it's done, and they do it at home.
But when we all do it, or when we are all doing this, do we have any chance of the teeth being stained again, or after you do it?
You definitely have to be careful. You don't have to, eat or drink things which can lead to coloration. Like, don't use a lot of turmeric when you're undergoing this procedure. So you have to be careful in these things. Yeah.
On the internet, we have so much things going around, and people bringing up so many videos, making videos on how to whiten your teeth in 5 minutes, 10 minutes. How true is that?
No, that doesn't work. That doesn't work. It's a big no-no.
It's a big no.
Yes.
Moving on to another type of cosmetic dentistry, they call it veneering.
Yes.
Tell us a little about that.
Yeah, veneering is also, there are different kind of veneering we do. Veneering is basically masking of the teeth. For example, you can use porcelain. These are they are not layman terms, but porcelain, composite are the materials which helps in veneering of the teeth. It's like masking. For example, you have fluorosis, and it's high-grade fluorosis. We just remove maybe half a millimeter of enamel and then mask it with a different material. Yeah.
When you say masking, I think it's more of putting in something on the teeth.
Yes, yes. It's like layering of the teeth.
Laying another layer on.
Yes.
How reliable is this?
It is liable. Again, anything artificial is artificial. You have to be careful especially when they do direct veneering, which is with the composite, as I told you. It's like you come to me with fluorosis, and I'll remove a little, half a millimeter of enamel from your teeth, and I'll mask your teeth with composite. So you have to be careful while you're brushing them, because if you're brushing it, that means you're eroding it, like you're removing the material which I've put for you. So you have to be careful of these things when we do veneering and such procedures.
So that brings in the question, so how are you supposed to take care of veneer teeth?
Yeah, like it's the upper layer which we mask, so don't brush hard on that. Yeah, be careful. Not that you stop brushing, but you have to be careful, because the bristles of the toothbrush are going to affect what we have put. Yeah.
But how different is this with shelling, which is covering the front side?
It's the same
It's
thing.
the same thing?
Yeah. It's shelling, it's the porcelain which we use. As I told you, veneering is different kinds. It's direct and indirect. So what you're talking about, the shelling, is basically we take the measurements of the teeth, we send it to the lab. The lab makes like a shell, of the porcelain, and we put it straight on the teeth after trimming them a little bit. Yes.
What about crowning? That is also another type
Yes. There are a lot of reasons we have to do crowning for. For example, if a patient undergoes a root canal treatment, it's mandatory that we do crowning after that, because after root canal our teeth become very brittle because the nerves are taken out. Yes. So there are chances that they break. Crowning becomes very, very important.
Well, that is very technical. Will you try to paint a picture to a layman on what really crowning is?
Yes. Crowning basically is like putting a cap on the tooth. Again, we cut the tooth surface and then we cap. Yeah, we put like a cap on the tooth. Again, it's made of porcelain. There's porcelain fused to metal. There are different kinds of caps which we put. Yes.
And for the three procedures that we've talked about,
Right.
how common is it? How common are eight of them?
They are very common. Each one of them I've discussed about. For example, crowning. Every patient who comes to me for root canal, I crown their teeth. It is very important. Then another thing is bridging of teeth. If a patient comes to me with missing teeth, bridging is what we do. Yeah.
What about that is bridging?
Yeah.
Or bridging and bonding?
Yeah. Bridging is basically if you have missing teeth. So what we do, we take support of the adjacent teeth and we put teeth in the middle. Yeah, like I'm trying to explain in the layman terms. You need support from somewhere. You can't put anything in the air. Yeah, so that's what bridging is. We take support from the adjacent sound teeth. Yeah, and then we put the bridge.
We'll hold it there, but we're now going to take a very short commercial break, and we'll leave you with the Healthy You segment. See you at the other end of the break.
Ten ways to stop bleeding gums. If your gums bleed when you brush or floss your teeth, you might shrug it off or think this is normal, but bleeding from the gums indicates an underlying problem. Identifying the cause of bleeding gums is key to determine the most appropriate treatment. Once you know the cause, you can choose among these 7 possible ways to stop the bleeding. 1. Practice good oral hygiene. Bleeding gums may be a sign of poor dental hygiene. To improve oral hygiene, brush your teeth at least twice daily and floss once a day. Good oral hygiene is especially important for pregnant women. Hormone fluctuations during pregnancy can also trigger gum disease and bleeding gums. 2. Rinse your mouth with hydrogen peroxide. You might keep hydrogen peroxide on hand to use as disinfectant. Turns out it can also remove plaque, promote gum health, and stop gum bleeding. If your gums are bleeding, rinse your mouth with hydrogen peroxide after brushing, but don't swallow the solution. 3. Stop smoking. Smoking can lower your body's immune system, making it harder for your body to fight off plague bacteria. This can lead to gum disease. Quitting smoking can help your gums to heal and stop bleeding. Talk to your doctor about the best method to help you quit smoking. 5. Increase your intake of vitamin C. Eating foods rich in vitamin C can strengthen your immune system and help fight off the gum infection that cause bleeding gums. Conversely, not getting enough vitamin C in your diet may worsen bleeding if you have gum disease. In fact, a vitamin C deficiency can also lead to bleeding gum even if you practice good oral habits. Foods rich in vitamin C include oranges, sweet potatoes, red peppers, carrots. 6. Apply a cold compress. Bleeding gums aren't always caused by gum disease. Your gums may also bleed from trauma or an injury to the gum tissue. A cold compress applied to the gum line can reduce swelling and restrict blood flow to stop bleeding. Apply an ice pack or a cold cloth to your gums several times a day, 20 times on and 20 times off. 7. Rinse your mouth with salt and water. Because bacteria and inflammation in the mouth causes gum disease, regularly rinsing your mouth with a mixture of warm salt water may also reduce bacteria and stop gum bleeding. Add half a teaspoon of salt to a glass of warm water and rinse your mouth for a few seconds 3 or 4 times a day. If bleeding is from an injury or trauma, rinsing with salt water mixture also keeps your mouth clean and removes bacteria that could cause a wound infection.